Say goodbye to dizziness, headaches, and migraines with these life-changing solutions. Today, we're going to talk about the top things that you can do at home if you're suffering with dizziness, headaches, and migraines. Now, the first thing I want to tell you is that this is way more common than many people think, and it can start as one form and turn into others. So I've had many patients who struggled with like a vertigo type incident, which led to dizziness, obviously in the short term, but even once that healed, they may have done something simple like the Epley maneuver or something like that. It led to headaches that were prolonged. And I've had some patients who have had migraines initially in the beginning that led to increased neck tension that then led to the dizziness. Now, for those people, they do the Epley maneuver and it doesn't actually work for them because their headaches and dizziness are actually coming from neck tension as opposed to a true vertigo or BPPV. So no matter which symptom you started with first, if you're suffering with all three right now, these are the simple things that you can do today to eliminate your dizziness, headaches, and migraines. Because let's face it, when you are not feeling like your best self, you cannot show up in the world the way you want to. And it definitely affects your daily ability to do everything, especially when you're dizzy, because you can't even drive. A lot of my patients can't even work at the computer. I treat a lot of people who work at a computer regularly throughout the day. And so if you can't sit at a computer for an hour or two at a time, it greatly impedes your ability to even work. But more importantly than that, they can't drive, which means they can't get out and do the things that they want to do. And often they feel like they just can't exercise because they've got this pain and this dizziness, and they just don't feel good. They just don't feel up to it. So it really limits how you're able to interact with the world and do the things that you want to do when you're suffering with dizziness, headaches, and migraines. So if that's you, then I definitely feel for you. And I definitely recommend that you find a specialist who can get to the root cause of your particular symptoms. This video today is going to give you some things that you can implement right now, but it's important to find out what started this problem in the first place. Like I said, I had a patient who suffered with migraines that led to vertigo, but it wasn't a true vertigo because it was from neck tension as opposed to a BPPV. So it's important to know your journey and what your body has done so that you can figure out what the best long-term solutions are for you. But for today, we'll give you some ideas that you can implement right now. And all of these tips are based on the common triggers for dizziness, headaches, and migraines. So we'll talk about the trigger and then what you should do along with it. Trigger number one is dehydration. Now, many people think, oh, I drink enough water every day, but do you know how much enough water is? The recommended daily amount of water is 80 ounces, and no, coffee does not count, and soda certainly does not count. It is 80 ounces of water. Juice does count, but that has a lot of calories, so be careful with that. 80 ounces of a clear fluid, that's not soda, friends. I'm telling you, soda doesn't count. So that's a really simple measure to be able to use. Now, an even simpler measure, I think, is to make sure that you drink enough water that your pee is clear, and then you keep drinking enough water so your pee stays clear. So that's really easy to check because you can check every time you go to the bathroom, and you know if your pee gets really concentrated that you need to be drinking more water. Now, you may notice if you use this technique that you tend to get more concentrated urine after you've been exercising. And that makes sense because your body's processing through all those metabolites that you released while you were exercising. So after you're done exercising, you need to make sure that you drink more water and get everything flushed out. You may have gone and gotten a really deep tissue massage at some point, and they recommended that you drink a lot of water the afternoon or evening after your massage. And this is the same reason why. When you have a deep tissue massage, it releases all the potassium, the calcium, all the stuff that's been stuck in those tight muscles, which is great. I mean, that's perfect. That's why you went for the massage in the first place. But you need to make sure that you drink the water to get things moving out. And I would add to it that you want to make sure you do some gentle motion to have some muscle contraction to make sure that everything gets cleaned out. So if you're suffering from dehydration, what you need to do is drink some water, not soda, not coffee, water. A little bit of juice is okay. Another common trigger for dizziness, headaches, and migraines is stress. Now, there's multiple reasons for this, because when we get stressed, we tend to tighten up the muscles in our neck and shoulders. So one, it could be just the direct muscle pull that's causing the dizziness, headaches, or migraines. The other thing that can happen, though, is when those muscles get tight, we tend to use these muscles in the neck to do what we call upper costal breathing. So your breathing happens up here, as opposed to using that big diaphragm muscle, which is actually designed for breathing in the first place. Now, if this sounds like you and you can't remember the last time you actually took a good deep breath, I'm going to recommend you check out this video here that leads to a whole series of videos that I did on breathing. It's very common in today's day and world, with all the stress that we've got affecting us and our busy schedules, to be suffering with this problem of not being able to take a deep breath. But our bodies are designed to work this way, and so when we're not staying in our best selves, it makes everything else more difficult. So I'm going to encourage you to make sure that you're breathing correctly. And the other thing I'm going to recommend you do is manage your stress. Now, I know that's really hard. We have a lot of things going on and a lot of things around us in the world. And there's only so many things that we have control over. However, we always have control over our reaction and over what we expose ourselves to. So you may need to put down the cell phone. You may need to stop watching the news. You may need to stop talking to some of those toxic people in your life to decrease your stress. But you need to find a way to be able to calm your internal world, because that will allow your body to function better. Now, this one is one that a lot of people may not realize, but there are actually certain foods that can trigger headaches, dizziness, and migraines. And it's different for everybody, right? I cannot give you a list of foods that these are the foods you have to avoid, because everybody's different. However, I would encourage you to keep note, especially if this happens on a cyclical basis. So how do you do that? I recommend a food diary to try to figure out exactly what's going on. And in that food diary, you put down what you ate throughout the day in order. Now, you don't have to keep track of the calories necessarily, because this isn't for dietary purposes in that way, like you're trying to lose weight. But keep track of all the foods that you've eaten throughout the day. And then in the next column over, when you notice your symptoms. That way you can look back over a week or a month and see if there are any common triggers. Now, the challenge is if you say that I have dizziness, headaches, or migraines on a daily basis, because then how do you know which food's triggering it? Then I would look through and what are the foods that you're eating on a daily basis. For some people, it can be dairy that can cause this type of symptom. So maybe you find that you tend to eat dairy with dinner, but not throughout the rest of the day, and you tend to have your dizziness, headaches, or migraines in the evenings. Well, then it could be that dairy is a trigger. Even though you eat it every day, you would still be able to see that pattern if you wrote everything down. And I know it's complicated to make sure that you write it down every day, but what if that was the one thing you had to do to eliminate your dizziness, headaches, and migraines? I know it's a little bit of work now, but it could have a huge payoff for you in the long term. Alrighty, friends. Now, I told you before about my patient who suffered with regular migraines, and then she came in because she was having some dizziness, and she actually came in because she wanted me to teach her the Epley maneuver. But after we did the evaluation, what I found wasn't the BPPV that was causing her to have the symptoms, which means the Epley maneuver would not work for her. It was actually that she had these very tight muscles that were attached to the back of her head and were squishing the cranial nerves. You see, all the nerves that innervate our head and face are located right at the base of our occiput, or our head bone. And what was happening for her is that those tight muscles were putting stress on those cranial nerves. And that is what was causing her difficulty with dizziness. So for her, what we had to do is relieve those tight muscles. Now, hers were excruciatingly tight, and there's no way she would have been able to do that up on her own. But for you, you may just be starting to have some of those symptoms. So I'm going to link a video here that I recommend people do who have really tight neck and shoulder muscles that will help to relieve some of the tension. Now, you'll know it's working if your symptoms decrease a little bit. It won't necessarily all go away at once, which means you need to continue doing these exercises and stretches regularly to maintain your results. Okay, so the top things that you can do right now to eliminate your dizziness, headaches, and migraines is make sure that you stay properly hydrated. Avoid the trigger foods that are causing your dizziness, headaches, and migraines. Decrease your stress as much as possible and manage your personal responsibility for it by doing things that take care and nourish your body, like deep breathing. And implement some practices to decrease tight muscles, to decrease that tension through your neck and shoulders. Now, if you have more questions about headaches, I'm going to drop a link below to our headache guide that will give you even more tips that you can implement right now.